Lung cancer is the leading cause of cancer-related death in Australia, often diagnosed at a late stage when treatment options are limited. But early detection can significantly improve outcomes. The National Lung Cancer Screening Program uses low-dose computed tomography or low-dose CT to detect lung cancer before symptoms appear. The program is expected to save hundreds of lives each year from lung cancer. Unlike the bowel and cervical screening programs, which automatically invite age-eligible people to participate, lung cancer screening requires a GP, nurse, or medical practitioner to assess a patient's eligibility and enrol them. To be eligible, your patient must be aged between 50 and 70 years, show no signs or symptoms of lung cancer, currently smoke tobacco cigarettes or have quit within the past 10 years, and have a history of smoking the equivalent of a pack a day, around 20 cigarettes or more, for 30 years. Requesting practitioners are advised to use clinical judgment and best estimates when assessing a patient's smoking history and determining their eligibility for the program. The NCSR supports the program by recording low-dose CT scan results, excluding images, automating screening pathways based on clinical data, and sending reminders to participants and providers when screening or follow-up is due. To begin, open a patient record. If they're aged between 50 and 70 and not yet enrolled, you'll see a prompt to enrol them. Scroll down to the Submit Forms and Reports section. If necessary, filter by lung program and select the Eligibility and Enrolment Form. The form will be pre-filled with your details. You can update this to another provider using the provider lookup. Confirm that the patient meets the eligibility criteria. If they decline to participate, no further information is required and you can submit the form immediately. If they agree to participate, confirm this and their agreement to receive screening invitations or reminders. If they decline, notifications will still be sent to you as the enrolling provider. Then, confirm whether the patient is suitable for a low-dose CT scan. If your patient is temporarily unsuitable, you can nominate a date for when they can commence screening. Additional questions will cover smoking cessation, clinical history, and demographic and cultural information. Next, submit the form. An alert will display confirming your patient's eligibility has been assessed and will receive follow-up until they are no longer age eligible, opt out, or are marked as unsuitable for low-dose CT. For guidance on how to support enrolled patients and submit clinical forms, watch our video, Lung Cancer Screening, Participation Management and Clinical Forms. To find out more about the National Lung Cancer Screening Program, visit health.gov.au/NLCSP.